Slidell Memorial Hospital, your hospital for life.
Welcome to another edition of HealthQuest, St. Tammany's response to meeting the medical information needs of you, the citizens of our parish. My name is Bruce Clement. I am the executive producer and host of the show. Today it is our pleasure to welcome back Dr. Matthew McElveen. He is a medical oncologist. He's the director of the Slidell Memorial Hospital Regional Cancer Center. He's no stranger to HealthQuest. He's been here before, and we've got couple of really good shows to talk about. Today we're going to talk about advances in oral oncolytic medicine. And did I get that right? Oral oncolytics?
That's close enough.
All right. Chemotherapy drugs that are given orally versus intravenously or subcutaneously. So, Dr. McElveen, welcome back.
Welcome. Thank you for having me.
How are things going at the Cancer Center in Slidell?
Things are going very well at the Cancer Center. It is quite busy. The last couple of years have seen a lot of success, and there have our infusion services have exploded over there. We've taken more physicians in. Recent coalition with Ochsner Hospital has brought some other services in as well. So it is going very well.
You know, I've worked with Dr. McElveen over a number of years, and just to watch the leadership and the growth of that facility has been very, very rewarding. And I will tell you that now it really has become a destination, a regional destination for the provision of cancer care in our area.
Yeah, I'm certain of that, and that's something that I hear from my patients all the time. We're developing a larger and larger footprint, so to speak, in the area, and the radius from which patients are traveling keeps getting bigger and bigger and bigger. Yeah. So we're definitely seeing that.
And what Dr. McElveen will tell you is that, you know, cancer therapy is very it's an organized and defined, many treatment protocols are laid out by National Institute of Health.
Among several others.
Several.
Yeah.
And so what you see is that the beauty of that is that many of the therapies will be very similar from location to location, and that 98% of the cancer care can be delivered at your regional or your community cancer center that you have at Slidell Memorial Hospital. So you don't necessarily have to travel anywhere to get the same treatment protocols that we have at this center.
That's absolutely correct. In fact, the only time you probably need to travel is if you're dealing with something that has so much rarity to it that your local and even, I dare say, academic physicians in an area as big as New Orleans just have not seen that much of that particular disease. In those situations, and again, it is a very small number, then yes, traveling is probably a good thing to a larger center. That being said, as you say, it's typically not the case.
Excellent. Now, we've seen an evolution. We're seeing some movement in therapy protocols. Specifically, we're seeing more and more oral agents coming onto the market and being used in quote-unquote everyday cancer treatment. Mm-hmm. And so today we're going to talk about oral cancer drugs. And let's talk first about the benefits of oral medication. What are some of the benefits that you see?
Well, historically, chemotherapy has been delivered intravenously. That tethers one to an infusion center where there are people there who have a particular skill in being able to do this. There's a lot involved in administering intravenous therapy. You have to have an intravenous access, which oftentimes will require a surgical procedure to place a port or an IV line that therapy is dispensed through. You have to adhere to a very what I would describe as a rigid schedule of infusion times. You're going to be in the infusion center oftentimes, depending on the regimen, for hours and hours, in some situations a whole day or 1, 2, or 3 days. If you think about an oral drug, now you can free up many of those things. Now, I will tell you that a lot of times we're using intravenous and oral hand in hand, and they'll sometimes go together. But what we're trying to get to, or we're trying to establish, is having patients on a purely oral regimen that frees up the issues with being tethered to the infusion center, to the intravenous access, the surgical lines. The other things that we are able to do is keep patients within their comfort zone. You know, having them at home and handling the administration themselves, I think gives them a little bit of empowerment for their disease. I've heard patients tell me that. The ability for a patient to have some type of control here is big. It can sometimes lead to problems, which we can talk about. But for the most part, you know, the best part of this is having them be able to treat themselves outside of that infusion center environment.
In some cases, and maybe not every case, we also see that by using oral medications, there may be a cost difference that could be significant. Mm-hmm. And so I know it depends upon the drug, and it certainly, you know, it certainly can change over time, but there may actually be some cost benefits associated with that. And at least, you know, you will avoid, when possible, the treatment in the center where you'll pay a facility fee, et cetera, and you have to pay for all those supplies.
Yeah, there's outside of the medication cost, what you're describing is the infusion cost, the fact that we have to have highly trained professionals, pharmacists and nursing, to do these things. That adds additional cost. Now, it's not to say that these medications are inexpensive. Most of them are quite expensive, but so is intravenous chemotherapy. And so you certainly can see a cost benefit in association with these medications.
Sure. Now you mentioned that there may be some concerns mm-hmm. about, you know, associated with oral oncology medicine. What are some of those?
Well, the first thing I would say is that when you do allow the patients to control this, you have some concern that they're potentially not getting all of the medications that they should get. And look, most patients are very, very good about taking their medications and handling their medications. However, you know, they're going through a lot here. And so, you know, patients, they still have side effects and issues and problems. There's nausea and fatigue and these sorts of things. So sometimes they'll forget to take a dose. I've occasionally had them take too much at one time, accidentally. So, you know, handling of the medication it can be an issue. There's several things that I always like to make clear with my patients when they take these medications is that if they are experiencing side effects and issues and problems, not to make adjustments on their own, that they need to call us so that we can assist with that. We can make adjustments. They're set up to do this. They also have to be very cautious with the medications as far as protecting them, especially if you're dealing with younger patients that might have children in the house. And you really, really have to be 100% certain that these medicines are protected and safe and stored away from young children and, of course, pets and those sorts of things. So that's the main issue in my mind is that safety aspect. And then secondarily, you know, you want to know that they're getting the appropriate dosing and that sort of stuff.
And one of the things that we need to point out is that even though the medication is oral, that doesn't mean that you're not going to have some side effects, right?
Oh, absolutely. In fact, there's oral medications that will have more side effects than their intravenous counterparts. And in fact, there's a very commonly used medication called 5-fluorouracil, which we use all the time, colon cancer predominantly. And it can run an intravenous continuous IV for sometimes 48 hours or sometimes a week at a time. This has very few side effects, surprisingly. The biggest problem is them wearing a pump for a long period of time. The counterpart is a drug called Xeloda. And Xeloda, probably I experience side effects 5 times as much as I do with the intravenous counterpart. Now, this is not the case for all of these medications. I just like to be clear that, because patients will come in seeking an oral medication thinking that it's going to be less toxic. That is not always the case.
No. And we talked about insurance coverage. Some insurance companies maybe don't want to cover the oral medications because of the cost, I would guess. I don't know.
Yeah, anything that's got a high cost associated with it is going to require a stringent process for approval. And we have to do that with every medication now. All of our intravenous medications and our oral medications go through the same process. So if I decide to prescribe one of these oral medications, it's going to take probably 7 days by the time the patient is able to begin this, to go through the process, and then the process of getting the medication to them. There's always some independent education from the manufacturer that they like to make sure the patient goes through to understand, like we're talking about, the handling and those sorts of things. So it takes a little bit of time.
Also that, we need to let patients know that in some cases there's an opportunity to work with the insurance companies and work with the drug manufacturers. If you can't afford your medicine, there are some other avenues out there where working with your medical staff, working with your hospital, or working with the infusion center, you may have an opportunity to perhaps defray some of the cost on that. Not always, but sometimes.
Yeah, it's not always. Fortunately, though, it is probably more often than people think. And I always tell my patients, say, look, if you go to fill this medication and they tell you that you're going to have an $800 a month copay, which is not rare in this type of situation, you need to come back and talk to us, because there may be some things that we can do. And what the drug companies realize, I think, is that if they charged everyone an $800 copay, which I say they're not charging it, it just what happens to be their insurance plan that has created that, these manufacturers know that their medicine's never going to get used, and they're going to lose money because of it. So they tend to have fairly aggressive programs to do these sorts of things, and thank goodness for it.
Thank you for sharing that with us. When your patient is in the infusion center, you have either eyes on them or you're right next door to them where you can walk across and check on them. You have a very structured environment. You have a lot of control, and you have the ability to make pretty quick changes if you have to in there. So our next slide talks about adherence versus access. Share with us your thoughts on adherence.
So this reflects back to what I was saying a few minutes ago. The adherence aspect is one of the relative unknowns, I guess, or level of discomfort for, I think, a lot of oncologists when it comes to using these medications. Are they adequately taking everything they're supposed to take? Right? In most of these medications, they're delivered in a dose that is divided between 3, 4, sometimes 5 pills. It's not because it's a high dose, it's the dose is what it is. It's so that we can make the adjustments. So if your dose is 5 pills and you have side effects, we can make an adjustment down to 3 or 2, depending on what that side effect is. I have had patients do this themselves and come in to tell me that 2 weeks or 3 weeks after they started it. So there's some concern there that they're not getting the dose that they should be getting. Whereas intravenously in the infusion center, we know that they're getting it. It's very clear that is occurring.
Now, when you're in the infusion center and when you're beginning a new medication, there's something called a loading dose. What is that, and how is that controlled environment in the infusion center?
Mm-hmm. This is not all medications, but some medications require a loading dose. It's sort of giving the cancer a kick, if you will. Oftentimes it'll be twice the normal infused dose. And if I'll back up for just a moment, infusional therapies are given on a schedule, sometimes weekly, sometimes every 2 weeks, sometimes every 3 weeks. So that first dose might be a a rather large loading dose to get the treatment started, and then it drops to 3/4 of that or half for the rest of the weekly or biweekly doses. So that's what a loading dose is, and we sometimes do have them in oral medications, not quite as often, but that's the that can lead to another potential adherence problem.
If you had to do the loading dose at home and you had you had ill effects from that, it would be
that's right.
It would be detrimental to for the patient to say, "Oh, I'm going to take the next dose, even though this one made me really sick."
Absolutely.
So talk about on the access side of this equation, you have that it is more convenient for your patient. It's a simpler process to take the medicines, but and the ability for them not to have to travel. Now let's talk about when patients have to go back and forth. They have a terrible disease, and they probably feel pretty bad. And the medicine sometimes, many times, doesn't make you feel much better. Mm-hmm. So moving patients around in cars and stuff, probably not as nice as it could be, right?
Yeah, there's no doubt. It's a challenging time of life, that's for sure. And if I could add to that, you have patients that really just may not live close, and it may be challenging to get to the infusion center as often as we need them to. Like I said, sometimes we're treating people every week, and then they have to make lab checks, which is usually a day or two before that, which is another visit. So there's 2 a week. Then they're going to see their doctor, typically on the average of every 3 to 4 weeks. So there's a lot going on, and if you could simplify some of that, which oral medications do, it's very helpful for people.
So that takes one of the transportation steps out. Mm-hmm. Do the patients typically have to get laboratory work while they're on their oral meds?
Yes. It depends on the medication. Some will need it just as often as an intravenous therapy. However, most will monitor labs initially, perhaps weekly, and once we know that there's relative stabilization of those numbers, we can back that off to every 2 weeks or monthly in some situations.
All right, and transportation is a very significant problem for a lot of patients because you probably don't want them to drive, if they're feeling poor, and they have to find someone to be able to take them or try to arrange for some type of transportation. So when it comes to what do we need to know, our next slide starts talking to us about informing your healthcare providers about your oral cancer meds. Yes. So does that mean like the rest of the physicians on the care team? Is that?
Yeah, certainly the rest of the physicians on your care team. Also your primary care physician, who we always want to stay in the loop on their patients' cancer care. These medications, depending on how they are metabolized through the body, can interfere with a lot of other medications. Now, of course, we go through a process of looking at these before we start, but it doesn't mean that they couldn't be started on something else after they're on these medications. So I always tell my patients, be very clear with your physicians. If they want to start you on something new, remind them. Say, hey, I'm on this medicine, will it interfere? And I think that goes a long way towards helping that. Also on the slide, you'll see what we talked about before, keeping away from children and pets. There's a good point here of keeping them in their original container. Patients have a habit of using those weekly planners.
Yeah.
And that can be hazardous when it comes to these medications. So I routinely will discourage these medications. Yes, they can use their other medications. They can keep it in there. I just don't want to see these medications get mixed up with something else.
Could be affected by humidity, by light, by temperature, and these may be more sensitive to those environmental conditions.
Yes, yes. And then further on, you have to make sure that you're taking care to wash your hands before and after you use these medications. I don't know of very many that can be crushed, or broken in half. Those sorts of things that that's something that your doctor will let you know if that's something that you can do. But in most cases, I would say these medications cannot be broken in half, and I would assume that that's the case because as a patient, that's why they have the multi-pill dosing, so that you don't have to break medications or crush and change them that way. And of course, storing away from heat and sunlight and of course moisture.
Yeah, going back to the pets for just a second, I have the world's most ill-behaved basset hound called Copper, and just because dogs are low to the ground, when they stand up, they're about 3 feet tall, and he can reach things off the kitchen counter and nightstands, and he's been known to do several bad things like that. So just because your dogs are small, or short, don't think that they can't get up on these counters and get the medication.
That's a good point.
So going on with more things that we need to know about this medicine.
Mm-hmm. So a couple of other things you'll see listed on the slide here, very important. Having a system to take these things correctly. A lot of patients will develop this themselves, and as long as we discuss it and it's a reasonable system to do so, that's fine. If they miss a dose, or they perhaps take an extra dose, they should make a phone call to their oncologist to find out what to do. In most cases, if you miss a dose, I usually just have them continue on the same dose the next day, not to double up. That's not really a wise thing to do. Unused and expired medications, don't just throw these out. You can't put them in your trash, and I would not dump them in the toilet. It's probably best that you bring them into the physician's office and allow us to dispose of those things appropriately. Again, these medications can be fraught with hazard in the wrong hands or taken accidentally. Even if they are expired, doesn't mean they have no potency. They might not have the potency that they need, but they can have a lot of potency and cause a lot of problems. And then, as we said before, contacting your physician if you're having trouble or difficulty with the co-pays and paying for the medications is many times things that can be done for that.
We also talk about carrying a list of medications, and there are some software tools out there now that the Epic system, for example, is collecting all of your medications, and you can actually download that and put that on your phone, your mobile device. We see that there are some clearinghouses from like pharmacy benefit management companies, Express Scripts, those types of people that collect information on your prescriptions and keep a digital file that many times, for example, Epic, it does feed back into the Epic system. So it's important that not only that you know what your medications are, but you need to have that for your family members in the event that you have a problem speaking or something happens and you're taken to your doctor or your emergency room and you're trying to figure out, what is that patient on. It's critical to have that list of medications.
Indeed.
So when we talk about drug-specific knowledge, now we're kind of getting down into the weeds here, but if you're going to be taking these at home, you need to learn about your meds.
Yeah, there's no doubt. Of course, you'd be surprised at how many patients don't know the name of their chemotherapy medication. And I think, again, it's not a criticism. They're going through a lot, but that is something that you should always have. And if you can't remember, because sometimes they are kind of technical and difficult to remember, then you need to have that list that you were discussing before. Understand what that medication looks like, all right? What the pill looks like, the color, the size, so that you can easily recognize it. Understand your dose and your schedule. We talked about that a little bit before. We got to be clear about what that dose is and that you're taking that dose, and that if you feel like you need an adjustment, you have to communicate with your physician about that. How to store it, side effects, and of course, this is a good point made on the slide here, is other drug and food interactions. It talked about the fact that we always want to bring this up to our physician if they start a new medication because of those reactions. But there's also food issues as well. And there's many oral medications that are out there that will have as a caveat that they don't want you to drink grapefruit juice. Okay, that just interferes with the medication. It interferes with the metabolism of some of these medications. That's not all orals, it's just there's some that are out there, but that's just an example. So those are the types of things that you want to know.
And if we look at side effects briefly, we can see that many of these are very similar to the injectable, right?
Yes. Yeah. Again, nausea and vomiting, it's hard to get away from that with a lot of these medicines. Thankfully, we do have a lot of good nausea medications these days, so much better than it was in the 90s, and it's just a great improvement. Hair loss is another thing. You know, patients, a lot of them think, well, it's not going to be an issue here, but you certainly can see that. Not with all of them, but there are some that can do that. And the blood count issue, again, it's a chemotherapy. You got to remember that. It's chemotherapy first and foremost. And it's going to have those similar effects.
Yes, and in our final slide here, we talk about some of the access points that these medications are obtained from. Mm-hmm. Specialty pharmacies have really just come into light in the last couple of years, where only certain pharmacies can carry certain medications, and you have to go to those pharmacies that are licensed and trained, I guess, in educating the patients. Private insurance may dictate, you know, that you have to get it from a certain location. Mm-hmm. You may have to get something direct from a manufacturer, or they may dictate where the medication can be sold from. And then, of course, your Medicare and your insurance plan, they always determine how things are going to be made. Yeah. So, Dr. McElveen, we thank you so much for coming back and sharing your knowledge on an evolving field, which is a very important step forward in chemotherapy, because it does give patients more freedom at a time where anything that can make them feel a little better is important, right?
Yeah, most definitely.
So from all of us at HealthQuest, we thank you for joining us today. Have a healthy day.